Marta, CEO of Paracelsus Recovery. I am incredibly excited to have today with me Dr. Paul Hokemeyer, a celebrity in my industry. I have here my personal copy, which hopefully will be signed one day by you, Dr. Paul. Thank you very much for taking time today to speak to me.
Thank you. It's a pleasure to be here all the way across, halfway around the world.
Thank you very much. Well, I already held the book up, Fragile Power, Why Having Everything is Never Enough. We will dig into that definitely later, but before we do that, how have you personally coped during the last weeks, during the COVID lockdown yourself?
They're challenging times, aren't they? It's been a bit of a roller coaster for me. You know, I have some days that are good and I have some days that are not so good. What I have found personally is that it's a process, and I have to ground myself in that process so that I don't get caught up in the swirl and the anxiety that's surrounding all of the uncertainty that we have in the world. So the two main ways that I do that is every morning I practice gratitude. I list 5 things for which I'm grateful. It could be as simple as just having a cup of coffee in that morning. But by doing that, by grounding myself in something, a number of things that I'm grateful for, I can keep myself from getting caught up in this swirl. And the other thing that I do is I try to live my life in 24-hour segments, because it's quite easy, isn't it, to get caught up in the swirl of what will the world look like once this is all over? What does the world look like now? What does this mean for humanity? What does this mean for our relationships, for our families, for our countries? But if I can keep myself in 24-hour segments and try to do something that has meaning and purpose, so grounding myself in gratitude and then finding something that has meaning for me personally, that I feel like I can make a positive contribution to the world, whether it's simple as picking up a piece of rubbish that I see on the street. Of course, then I go immediately and wash my hands because we don't know with the COVID. But again, it's doing something that's positive and tangible.
Thank you very much for sharing your personal insights and your tips.
Yes, sure.
If I may extend in that direction, so what is the most suggested tips that you give to your clients?
Basically the same thing. So it's keeping themselves grounded, living in 24-hour segments, finding something to be grateful for, and creating meaning in our lives. You know, this is an extraordinary moment for humanity, that we are living in a huge transformation of our world order, of power. You know, my work is around power constructs and identity constructs, and because of the lockdown, we are being forced to spend an enormous amount of time with ourselves. Most of my patients who come to me are living alone, and they're suffering from extraordinary existential anxiety, and they're hungering for connection. And they're digging quite deep, and they're asking themselves very important existential questions. Who am I? What do I want the world to be? How do I want to live in this world? And through COVID and through the lockdown, we've all experienced an editing of our lives. So the world, you, me, you know, my practice is very international, and I was probably in a couple of different cities a month, and that's not happening anymore. And so I'm forced to spend a lot of time with self. My patients are forced to spend a lot of time with self, and we're working in terms of making meaning and moving ourselves and our world and our relationships in a reparative direction, because I think we all recognize that there was an enormous amount of destruction that was happening personally, interpersonally, and then social culturally.
So you have touched upon now the new reality that we live in, and
Right.
also the topic of purpose, and also topic of loneliness. If we could maybe expand a little bit on the topic of new reality and the implications of loneliness, and then I would add another word, aloneness.
Mm.
So what are your clients now facing? Is it aloneness or loneliness? And is this what is most difficult for them, or something else?
They're quite similar, but quite different, aren't they? This notion of loneliness and alone. And so alone can be very rewarding and very enriching. And if we look at most of the great philosophical thinkers, psychological constructs, people have removed themselves of the world from the world to think constructively, and to spend alone time. Loneliness is this angst that we get when we feel disconnected from the world. And look, human beings, we are built for connection. We come to being in relationship with first between our parents and then in the body of our mother. And the first moment of existential anxiety that we have is when we emerge from the womb, right? And most of my parents, many of my patients always say, you know, the problem started when I just came out of the womb. So, and that's quite true, isn't it? Because we have this profound moment of disconnection when our lives depend on the care and nurturing and being seen and validated by another human being. And depending upon the quality of that relationship, depending upon the quality of that mirroring and that nurturing, that really sets forth the trajectory of our life, how well we are, how safe we feel in the world, how safe we feel in ourselves, how safe we feel in our relationship. So this loneliness is this angst that claws at us, that we need to feel connected with other human beings. And I know in your work in particular, most of the patients who come to you are suffering from some sort of substance abuse disorder. And so that is a need to fill or to medicate the angst that comes from feeling this existential loneliness that haunts us. And it haunts all of us. We all feel, you know, alone. I feel certainly alone in the world, and I have, as I wrote in my book, at very important developmental phases in my life. And then the issue becomes, what's the quality of the therapeutic team that you align yourself with to get you out of that loneliness and to make that therapeutic connection?
So we have clients that share, even though they're surrounded by their spouse, partner, children, they still feel very lonely. So they experience loneliness. How would you explain that in your view?
We all have this need to be seen and validated. That's deep in the core of us as human beings. And so a lot of it is biological, you know, because again, our existence depends upon being properly seen and validated. And that doesn't, it ebbs over life, you know, when we find meaning and purpose and in our lives, but it's still with us all the time. And, you know, I look at that as basically like a life force. So that angst, that discomfort that we have to connect causes us to move, hopefully in a reparative direction. Hopefully, if I'm feeling disconnected from my spouse, that I will take actions to make a meaningful connection with him or her, but not often, right? Sometimes we get off track and we find spending money kind of to soothe us, or we find alcohol to soothe us, or we find prescription drugs, or we find exercise, or we find food. You know, you can find a whole other, you know, there are lots of ways to try to medicate and to try to soothe that. But that hunger that we have to connect with another human being is a force that, when properly directed, can move us in a reparative, healing direction so that we can move ourselves to be the best human beings that we are called to be on this earth. And I think that if we are placed on this planet, that we have a calling, that we have a mission in life, and that we have an obligation to be of service to the world and try to improve humanity. And that's organic, that's hardwired into our DNA.
So in the last weeks, from time to time, you see little videos from, let's say, famous singers who are stuck at home, who are supposed to go on tour and they're all alone. So
Right.
what kind of fear are they facing and how they are dealing with?
They're missing that external validation. So the nature of a celebrity construct is that, particularly, this is why celebrities who achieve celebrity at a very young age struggle so much, because they get this extraordinary elevated baseline level of gratification. So a celebrity could have, they have millions and millions of adoring fans, right? And so the validation that they get from that is extraordinary. The highs are really high and the lows are really low. And it becomes a bit of an addictive process, doesn't it? And so we know that addiction has two key elements. There's the notion of tolerance and withdrawal. So tolerance means that I need more and more of the activity or the substance to achieve the same baseline level of satisfaction. So let's say I'm a music star and I've sold 2 million records last time. Now the expectation is that I have to sell, for my next record, I have to sell 3 million at least, right? So, and in simultaneous with this expectation of having to do more is this terror of failing, right? Because when you're up on a perch, really you think the only way to go is down, and there's this extraordinary anxiety and this extraordinary fear of failure. I mean, think about it from the other side. If I'm living my life in failure, I can kind of always have hope that that can change, right? But for celebrities, it's extraordinarily difficult because they live in such a high baseline level of validation and external rewards. And the lows that come with that are quite extraordinary. And typically what happens is that they don't have a proper support system around them to provide them with, let's say, what are qualitative measures of success. Integrity in relationships, being properly seen and validated for their humanness, which is the central of my work and your work as well. It's piercing that veneer of labels that we assign on every human being that walks around the planet. Woman, right? You're a woman, and so there are certain labels and there are certain expectations that are around that. If I'm a person of color, that has a very significant meaning in our society and our world still today. If you are a celebrity, that's another label that we have all sorts of expectations and prejudices about what that means. In order to deliver quality therapeutic care to that patient who comes, that celebrity patient, or that woman, the beautiful woman who comes to you, or the person of color who comes to you, you have to pierce those, you have to push through, you have to acknowledge those labels, and then you have to push through them to get to the humanness, to get to the person who's in pain underlying those labels. And that's the art of psychotherapy, and that's the art that I write about in my book.
You gave me a very good chance to now touch upon the topic of cultural competence, if you allow. If
Yes,
you could
please.
please elaborate a little bit on your concept and how you have applied it successfully in your work with your clients.
So throughout my career, my career as a therapist and as an author has been rather circuitous. It has not been a direct line at all. It has been, I started my career as an economics major and I was in banking, and then I became a lawyer, and then I went into the realm of philanthropy and I was doing social justice work. And throughout that thread of my existence, I saw that people of wealth were being addressed and viewed and talked about in a very objectifying way. And I did my training with a very marginalized population. I worked with HIV positive transgender sex workers. And so you have one end of the economic and power bell curve. And then simultaneous as a lawyer and in banking, I was working with another, the complete opposite side of the economic and power bell curve, which were people in extraordinary power. And I observed that there were, while the externals of these people's lives were quite different, internally, very much the same. They suffered from things like an insecure attachment, where someone early in their developmental path had betrayed them. And so they viewed human relationships as unsafe and actually dangerous. The field that we are in, the field that we work in, the field of behavioral health, had done an extraordinary job of working with people who live in the world in positions of powerlessness. So if you think about theoretical constructs like feminist theory, upon which I base my work, um, notions of LGBT work, the construct of minority stress that came out of Dr. Mayer out of Columbia University, that said that people who live in the world in minority positions don't suffer from substance abuse and mental health disorders because of they're genetically predisposed, but more because of the stress that they experience by living in the world in the minority position. And I thought to myself, well, wait a minute, here I am working with a population over here, people who live in the world in positions of power and wealth. That's a minority population. We call them, the top 1% or the top 10%. Why haven't we looked at the distinct cultural markers of this particular population and developed a clinical construct to address it? And so my PhD work, I did a master's degree in clinical psychology with a focus on family systems at a very progressive school where all was talked about was being culturally competent and being able to address people who are different from ourselves. But those were all people who lived in the world in positions of powerlessness. And so for me, as a privileged white male, I came in as the white doctor, and they looked at me with, a lot of respect, and they would tend to listen to what I said because I brought with me all this power. This other group, not so much. They challenged everything that I said. Who are you? I just sold my company for 500 million euros. Who are you to tell me what to do? And I thought, this is interesting that we have not been able to develop a effective clinic. And then we wonder why celebrities continue and people of wealth fail to get the quality care that they need, right? That the deaths are legion. I mean, we just think everything from Marilyn Monroe to Whitney Houston to Prince, the list just grows every single day. And I thought, well, that's because we haven't developed an effective clinical philosophy, therapeutic technique to address them. So I did my PhD in ultra high net worth identity constructs. So how people of wealth in particular manifest their identities intrapersonally, personally, interpersonally, and then social culturally. And I developed a clinical formulation to address the humanness with that population. And look, this isn't a better than less. A lot of my work, I get some pushback in terms of, in fact, when I was looking for my dissertation committee, that several of very esteemed, one particular existential psychotherapist who's very renowned, said to me, Paul, why would you waste your time studying rich people? and I immediately said, I was very clear. I said, for that very reaction that you just had, because there's this like, they're not worthy of study, and that as a human being who believes in culturally competent and clinically excellent and compassionate care, for I don't care where you are on the economic bell curve, I don't think that we can put an economic threshold on who's deserving quality, culturally competent care. And so off I went, and I did my PhD, and then, and then working with a number of clinicians, and I work with you guys as well. Like really developing training clinicians to work with this particular population as a cultural competency, and getting away from this notion of better than, less than, more deserving, less than. If you are born on this planet, you deserve care that respects and honors and meets you in your distinct identity construct.
That's a very nice way how you put it. And I'm sure you're often being asked that question, why are those wealthy people deserving to be treated and to be treated so well? There are enough less wealthy people who are much more struggling.
Right.
So now that you are focusing on this particular minority, in your daily job right now, have you had much more requests since the lockdown, or has your work changed?
It's changed, and it's been my practice is I tend to have a small practice because the people that I work with are complicated, and the power, managing the power is a lot is a lot of work, as you well know, and so I tend to have a small practice, but my practice has really grown. It probably doubled in the last couple of months, from patients who I had seen before who are coming back, from people who are just feeling profoundly alone, from people who really kind of want to use this opportunity to create meaning and purpose in their lives, and reevaluate how they're living their lives, and how they're spending their time, and how they're spending their resources in particular. People are really hungry for meaning right now, and using this time for transformation. You know, the people that I have the privilege of working with accomplish. Success is a very important thing to them, and I do not diminish success. I think success is very important, and I think power is incredibly important, and I want to see power used in a healing, constructive way. And I think where we are now in our society, in our world, we have had an explosion in narcissism, and narcissism is a way that people can use power in a very destructive way. And so through my work, I enable my patients to connect with humanity, right? Because most of the patients that come to you, right, patients that come to me, they live, one of the cultural markers of this particular population is isolation. And so because of this, this isn't unique to this population, all minority populations feel isolated from the rest of humanity because they're a minority population, right? So I mean, just inherent in that identity is a sense of isolation. And so my work enables my patients to develop empathy and to develop compassion for the rest of humanity. Look, we have been talking about wealth inequality for decades now. It's only getting worse. It's not getting better, because basically you have this division, you have this construct of us versus them. And in this place of division, we're never going to heal the gap. My work is to work with people of power and help them realize that empathy and compassion for other human beings is a valuable proposition. And by doing that, I hope that I can do my part to help bridge the gap between the haves and the have-nots.
Wow, that's a very beautiful way of doing that. So you're
It's an
really
ambitious goal, but you know,
very ambitious. Very ambitious.
but because I look at what we've been doing, and it's not working. It's only getting worse. So I feel that the solution can come in mental health and relational healing, and that's my calling. That's my work.
I can absolutely feel that this is your passion and you are dedicating your life to this. So if I may ask, are you seeing more men or women? I'm very interested if, let's say, the strong, I'm now speaking in stereotypes, the strong men who are not supposed to show weakness, if there is a shift now through COVID and that there is a distribution?
There is, you tend to see, it's interesting, this profession, you tend to see who you are. And my career is, I tend to see like the issues that I need to work with in my life. So the universe puts my patients in front of me to sort of help with that process. And I tend to see more men because I'm a man. And, the field of behavioral health, there aren't many men. It's very much a woman-dominated field. And I think empirically, like it's maybe 30% of the field are men. And so, my practice probably tends to skew more towards men, but I see a lot of women as well. It's really a function of the issue, and it has to be a proper fit, right? It has to be a proper fit for me. The first question that I ask myself when I'm approached by a new patient is, what's the value that I can give to that patient? And if I can't come up with a very clear if I can't articulate a very clear value proposition, then I will refer the case out. So I won't take the case. So I have to feel like that I can provide real value to that particular patient, regardless of the gender, actually regardless of where they are on the socioeconomic spectrum. I mean, I have patients who are, who are not wealthy as well. And so it just depends on what the presenting issue is, and as if I feel that I can provide value to that particular patient.
So regardless of wealth, all we have in common is the topic of purpose, right? So why is humanity now in a purpose crisis?
I think that there are a number of reasons. I think that, so I like to think in terms of like the macro and the micro. So I like to think in terms of like the global and then the personal. So from a macro standpoint, I think that we have, I think technology has really, it's an extraordinarily wonderful thing, but our humanness has not been able to keep pace keep up with the pace of technology. So if you look at other industrial revolutions, they were slow, much slower. We as human beings are extraordinarily adaptive, and that's one of the things that I'm learning and that we're seeing in this pandemic is how we've adapted to this technology in particular. Even though I had an international practice, I was very resistant to see patients over technology because I like to work with all of my senses. We're human beings, particularly human beings who have trauma backgrounds. We intuitively feel our way through the world. And patients, and I work with a lot of patients, probably 90% of my patients have some sort of trauma in their background. But I've adapted to this technology. I mean, it's a lot harder for me. I still struggle with it, but we do it. So from a macro universal level, our central nervous system has not been able to keep up with technology, and we're flooded with all sorts of information now. And then I think that power has been taken by people who don't deserve it and who aren't responsible with it, and who have used it in very narcissistic, destructive ways. And I think that again, that it's been an integration that we've conflated celebrity with compassion or with qualities. We've projected a lot of undeserving qualities on people in power, and in that process, we as human beings have given our power away to people who don't deserve it, and we're finding ourselves being betrayed by those people who occupy those positions of power. And so I think that that's where we are, and I think that one of the gifts of this pandemic is that again we're being forced to spend more time with self and in meaningful relationships with our lives, so with our spouses, with our families, and we're finding our power in that. And I hope that we're going to be able to reclaim the power that we've given away, that we've been seduced. I wanted to say given away carelessly, but I don't think that that's a fair statement. I think the fair statement is that we've been seduced to give our power away to people who don't deserve it. We live in a world, particularly in the West, where we are constantly bombarded with commercial messages upon what does it mean to be a person of value. So am I value if I don't drive an expensive, am I a person of value if I don't drive a expensive European sports car, or if I don't have a Swiss watch on my hands? I have to give a shout out to Switzerland, to wear, and we are rewarded literally for spending money. When you think about all of these reward programs, are credit cards. We get points, we get reward points for spending money. So we have been seduced into this culture of believing that success is an outside job, and that we are what we own. If we don't have a designer handbag, if we don't, the list goes on. And so I think we've been seduced to giving our power away to entities and to people who don't deserve it, and who can't handle it. And we need to reclaim our power back.
But if we look back again on the celebrity topic, those people are very powerful, right? And
Exactly.
successful. And
Right.
how come if they're so powerful and successful, still, in some cases, there is a purpose missing? Where's the
Because power is like, I mean, the power of celebrity is like the power of electricity. So electricity is an amazing thing. You and I can communicate halfway around the world because we have electric, we have power. Power, if it's not properly utilized, electricity can kill a person, right? If I put my hand on his, so power, the power of celebrity in particular, has to be used in a constructive, positive way. And so, and that requires a very strong scaffolding, internal scaffolding, a strong sense of self, um, a sense of self that's divorced from the celebrity identity. So if you look at people who I think have been quite successful in managing their celebrity identity, they've been able to divorce their selves, their true selves, from their celebrity label. Kim Kardashian is actually a good example. So Kim Kardashian has this persona, and I don't know Kim Kardashian, and I've never treated her. Big disclaimer here, but as a social scientist, I'm also a researcher. She's created this fiction of herself. If you've ever seen an interview of Kim Kardashian as a human being, it's quite different, isn't it? And so being able to separate those two out, and successful and celebrities who haven't been successful at doing that haven't been able to tease that out, and they've given their power away to people who don't deserve it because they don't have the internal scaffolding to be able to weather and to be able to use their intuition in a way that tells them who's trustworthy, who's worthy of trust, and who's not worthy of trust. Which brings me to perhaps not us, but me to another construct that I think is important to talk about in our world, which is this notion of vulnerability. So a lot of popular psychologists are now talking about this construct of vulnerability as if it's this carte blanche, that it's vulnerable, that we should be vulnerable in all areas of our lives with every human being we meet. That is so dangerous. That is like such a fiction that vulnerability needs to be used strategically and in a way that challenges us to grow, but that's safe and that's grounded. And this is particularly important for people who have a trauma background. And I think that celebrities have they're vulnerable in so many areas of their whole existence is about critique and about judgment. Like every piece of work that comes, every act of creation, inherent in a creation is judgment and criticism. Mm-hmm. Every work of art, every piece of literature, everything that involved, every meal that we make, right? Every cake that we bake has judgment in it. Oh, this is so good, or this isn't. So inherent in creation is judgment. And when you're a celebrity and when your whole life is built upon creativity, and the bigger you get and the more expanded that becomes, the more intense that judgment is. And it just claws and eats and scratches. And it's, as we see, it's profoundly. And then historically, these human beings don't have a place to go because their clinicians objectify them and manipulate them, and because they haven't been trained to work with them as human beings. And the field of behavioral health has done a good job in terms of marketing to this particular population, but they haven't done anything in terms of developing any clinical formulation behind them. I worked with a number of treatment centers around the world, and my work was always like, well, wait a minute, you have these beautiful marketing materials, but how about your clinical team? Would your clinical team know what to do, how to properly handle a patient of mega wealth or mega celebrity who came in, or not? And typically they don't have very good answers. So that's actually why I wrote my book and came up with a distinct clinical formulation.
It's really very, very exciting what you write about your book. In your book, I have so many questions on my list, but I would like to continue on that topic that you have raised right now, with regards to those celebrities who have the power, who have the people around them, who are successful, and then, for example, Amy Winehouse takes her
Mm.
life. How is this possible? Those people are for sure not alone. How can it come so far? I mean, alone physically.
But they're lonely, right? But they're lonely. I mean, I think if you look at sort of the narrative of Amy Winehouse, that it was a narrative of she didn't have anybody who she could attach. She didn't have anybody who could trust, and that the people around her, the significant people who should have been protecting and caring for her, were the people that were basically engaging in exploitation. And so she didn't have an anchor. There was nothing for her to grab a hold on that was worthy of grabbing a hold of, and that's typically what happens. The person who really breaks my heart the most is Whitney Houston.
Mm.
I mean, the most extraordinarily talented, everything going for her, and yet she was just cast at sea. And look, I lived in Hollywood for a long time, and I know that people knew that Whitney suffered for a long time, and nobody was able to really step up in a way that was able to bring some reparation, to repair her, to give her an anchor in the world. And that's what happens, that people begin to yeah, I mean, it's not a new tale that people view them as objects, and that people just suck the life force out of them, essentially, is what happens. And they just become shells of human beings. I mean, look at the narrative of Prince. Again, Michael Jackson, the same narrative, right? Um, that these were the most talented, brightest lights on the planet. Judy Garland, and their life force got sucked out of them. I think somebody said, it wasn't me, but that another celebrity, maybe it was Frank Sinatra, observed of Judy Garland that every time she performs, a little bit of her dies. That her light was so bright and so extraordinary, and she gave so much of herself, that it just diminished and depleted her, and she didn't have other human beings to fill her up, because everybody was just sucking the life force out of her. So it's a sad tale. And then, then they go to a treatment center, or go to a clinician who just doesn't know how to deal with them as celebrities first, and then manage all of that process that goes on, all of the testing, all of the challenging, all of the patients, when the celebrity patients come to us, they need to know intuitively that you are not going to treat them like everybody else does. And to get there, they're going to test you and challenge you and try to seduce you, right? Because that's how they operate in the world. And so as a clinician, you have to be able to have the presence of self and the wherewithal to tolerate those extraordinarily, like I write about in my book. How many times have I been fired by a celebrity patient? A lot. Yeah. And so, yeah. And hopefully they will come back. You know what I mean? When they realize that you're not going to fall in to the trap that they're laying for you. And they're laying the trap because they need to know, can you hold the enormity of my pain? Are you trustworthy? That's a felt experience. Just because I wrote a book and on celebrity patient, just because I did my PhD research, doesn't mean that I can do that. They have to intuitively feel that, and they will push me away, push me away, push me away, push me away. And that's why the work is so challenging, and that's why you can't do a lot of it. You have to do it in very small increments, because it'll eat you up alive.
So do you also give advice to the children of wealthy clients? I mean, children also can be grown-ups.
Right. Tend to be. I give them the same advice that I give all my patients, regardless of their wealth, which is find meaning in life,
Mhm.
and get over your anger towards your parents,
Mhm.
basically. That one of the fundamental truths of growing up is realizing that probably our parents are not perfect. They're not really the people that we would have liked them to be. And guess what? We're probably not the kids that they would have liked us to be, too. And so that is a huge thing to recognize. And, you know, give your parents a break. Don't be resentful towards your parents. Don't be angry for your parents, regardless of where you are. And this goes towards poor kids. This goes towards rich kids. This goes towards middle class kids. And really find meaning and purpose in your life. That is the thing that connection and purpose are the two most important things that we can have. And connection based on integrity, connection based on values, um, and that's all integrated, isn't it, with finding meaning and purpose in your life. And if like if you have a famous surname, that's kind of a hard thing to get out of, right? And so claiming your identity and claiming your purpose in the world. Is it more challenging? Yes. Is it impossible? No. Is it critically important for the well-being of you and your children and your family? Yes, absolutely. So get over your resentment, get over your anger, and go out and create something of value in the world. Even if it's, if not even, but if it's raising a family, if it's
Mhm.
being the best mother that you can be, if it's being the best father that you can be, um, yeah, being the best at which you can, being best at what you do. Success is not a bad thing. Success is a really good thing, and we should all strive to be the most successful people who we can be, because that enables us to give back to the world and try to heal some of the damage that we're living in right now.
Now I have to challenge you on this. Do you think ambition, being ambition, is a good thing or not such a good thing?
I think it's a good thing.
Okay.
Yeah, I think ambition is a really good thing. I think that it's part of us being humans. I mean, look, we're hunter gatherers. That's who we are. So we are built to go out into the world and get nuts and bring them back, right? And so ambition is a really good thing. And we need to have ambition to make the world a better place, right? So we didn't have ambition, if we were just sort of satisfied with the status quo, we wouldn't have the technological advances that we have. We wouldn't have the medical advances that we have. We wouldn't have the advances in human rights that we have. I mean, look, we're living in some challenging times right now. We've lived in challenging times in the past. We've gotten through them. But if you look kind of the trajectory of the human existence, we've accomplished some amazing things. We've cured diseases. We have addressed civil rights issues. Apartheid, for example. Do we have a lot of work to do? Absolutely, extraordinary. But that's where ambition comes in. So we have to have ambition to improve ourselves, our relationships, and the world around us.
So this means being ambition is not ego-driven, actually.
It can be,
Can be.
but I think the ego is a healthy thing.
Okay.
You know, I think that the narcissism is like vulnerability. It's a word that we throw around a lot, and we don't quite understand that narcissism exists, like everything in life, on a spectrum. So there's healthy adaptive narcissism, which involves the ego and needing to be validated for our work, right? I mean, when I'm validated for my book, it's incredibly rewarding for me. That's my ego, right? That's fine. And if I didn't have an ego, then I may have not wanted to write this book, to put this voice out into the world. Um, and so ego is a very, I think ego is a healthy thing. It's like anything in life. It's how is it channeled and how is it utilized. Um, so ambition, ego, those things are critically important. When we put our ego before, when ego, excuse me, begins to eclipse our integrity,
Mm-hmm.
that's when we get into challenge. And when our ego begins to eclipse our ability to be able to empathize with other human beings and find compassion for other human beings, that's where it gets into trouble. When those two things collide in a conflict, that's where we get into trouble. when they coexist as one trajectory, it's actually a bad, that's actually a, so there was a slip. That's actually a good thing, because
Mhm.
we're using our ego in a constructive, healing, healthy way, productive way.
So if we speak about the ego and you just mentioned narcissism, then what is healthy self-love, if I may use those words?
You may use any words you like. So, healthy self-love is the capacity to see ourselves in a respect ourselves, being able to maintain humility, which is the capacity to be teachable, to recognize that we are imperfect and that we are a work in progress. I don't care how much money you have. I don't care how much success you've attained. I don't care how big of a celebrity you are. There's always work that you can be doing, to heal and to grow and to make our world a better place. So healthy self-love is this capacity to negotiate the tension that's in all relationships, which is this need for connection and this need for independence.
Mm-hmm.
So I need to be able to have my own identity. I need to be able to have my voice, and I need to be able to coexist in the world and in my relationships with a degree of humility and with a degree of grace and with a degree of compassion for self and others. So it's a titration. It's a melange. We always want to think that it's just one thing, and we want to put things into good or bad. Ego's bad, ego's good. No, it's a melange. It's a combination. It's a synthesis of things. And so healthy self, or love of self, I think was the word that you used.
Yeah, self-love, healthy self-love.
Self-love. Okay, I'll get there. Self-love is that capacity to find autonomy in self and to be comfortable in what we talked about in the very beginning, which is aloneness,
Mm-hmm.
and then to be able to negotiate togetherness in a productive, generous way with others, and then in the world that we live in, because we can't ignore that we live in a world that's become we're all very connected around the world. I know what's happening in Switzerland. I know what's happening in Saudi Arabia. I know what's happening, everywhere in the world. And so yeah, it's that negotiation.
There is a very nice sentence in your book which I would like to read. It's from
Please.
chapter 8, Connected, a new standard of compassion and healing. You give such valuable insight into treating elite and powerful clients. And the quote is, "We must create treatment frames wide enough to hold these individuals in the uniqueness of their identity, while facilitating a relational connection that moves them in a reparative direction." Can you tell me more about this?
It was basically what we just talked about in terms of love of self, or self-love. Sorry, I keep screwing it up, but it's this capacity to negotiate a number of different factors. So treatment, if we think about what treatment is, and we think about residential treatment, so you have a person who's occupying in a system where they're causing destruction of self, destruction of relationships. And we need to take them out of that system and put them in another system, a contained system, which is what your program does and other similar programs. You take a person out of their environment and you put them in another environment that's safe and contained and that's very boundaried and has very specific rules. So that's the framework. You create a new frame. Now, what you create within that frame is where this need to negotiate the uniqueness of that particular human being that is in your program or that's in your office, in your clinic that you are giving treatment to. No human being is the same. None of my patients are the same. None of the relationships that I have with my patients are the same. None of my treatments, I've never done like two treatment formulations that are the same. Everybody brings such uniqueness to the situation. I bring my uniqueness to the situation. And so we need to create a frame that holds that person and holds us in our therapeutic relationship, and then begins to well, really do a dance, isn't it? To dance in our personality and in our presentations, and get into the challenges. You know, you challenge the patient, because you don't need to you don't need to give the patient the same old, everything that they have in there. You need to give them a repair. My job is to give them a reparative relationship, which means that I need to figure out what their relationships are like on the outside world, and then tweak my relationship with them in a way that I'm able to be there for them, to see them in a respectful way, but to challenge them. I need to challenge them. I need to poke them from time to time, don't I? To kind of get a reaction and then challenge that reaction. You know, there are a lot of really clever people out there who are developing apps, you know, and I've been asked to be on advisory boards of several of them. And, you know, everybody wants to create an app to heal like extraordinary, you know, like mental psychic pain. And I mean, okay, have at it. I'm I'm a knitter. You know, like I consider myself. I'm an artisan. I work individually with patients. I think this work is about quality, not quantity. I don't. I could personally. I just can't do this to scale. For me, I don't see how the healing process of human beings, when the damage was caused in a relationship, how you can achieve that on scale. Look, I've been wrong about a lot of things. Perhaps you can. Perhaps 20 years from now they will have done that. But I think you need to work very intimately in the bespoke nature of each individual relationship. So that's a very long-winded answer to what was a very succinct quote that I gave in my book. Perhaps I'm a better writer than I am speaker. I don't know, but I think that that's it. It's just creating. I view my work as an art. I am an artisan. I am an artisan of human relationships. I base my art on science. You know, I draw it in the book. It's all based upon empirical data. But when you're sitting with another human being in a room who has experienced extraordinary psychic pain, who believes, who from a physical standpoint believes and has been shown that human relations, that human beings are unreliable and dangerous, you need to be very artful in that relationship, don't you? And I don't think you're going to get that from an app. You might, you'll be able to work on the surface, but what we really want to do and what we do in our work is we create deep, lasting change. And that's a very slow process, and that's a very intimate process.
I can very much feel how much you are with your heart in what you are doing, and it's touching me all the way to Switzerland.
Okay. Which is...
So we touched upon a lot of topics. We spoke about loneliness, aloneness. We spoke about purpose. We spoke about success. I have so many more questions to ask, but my last question for today would be to Dr. Paul, if he could please answer as, from a human perspective, with weaknesses, with humanness, what is the message from you out there to the humanity who is now trying to cope with the new normal?
Be kind to yourselves and be kind to others.